I'm going to introduce you to a concept called the infant primary assessment. And a primary assessment is the same thing that an EMT does when an EMT arrives on scene. What they do is they do a very quick assessment of the patient. And any time that we believe that our infant has been injured, let's say that they roll off the bed, or they're taking their first steps and they stumble and they hit their head on the side of a table, or they've fallen in some way, we always want to do a thorough check of the infant. And so we're going to run what's called the infant assessment system. And so the first thing that we're going to want to do is we're going to want to make sure the scene is safe. We want to make sure that there's nothing in that room or wherever the infant is that could hurt us. If the infant is tangled up in a bunch of electrical wiring and you believe the infant is being shocked, we want to turn off that source. So that's one way that we can make the scene safe, by turning off the electricity. So after making sure that the scene is safe, we want to form a general impression. What do we think happened? Why is our infant laying on the ground? Or why is our infant crying and appears to be hurt? So form that general impression. We also want to check for life-threatening bleeding. And life-threatening bleeding is where we see blood spurting out of the infant, or we see the infant covered in blood, or we see the infant laying in a pool of blood. If we find this, we need to stop right here and we need to take care of bleeding and stop the bleeding, because if we don't, that could kill the infant really, really quick. So we're going to talk about methods of stopping bleeding later on in this course. Now, the next thing that we want to do is we want to see if the infant is awake and responsive. And if the infant is crying, then we know that the infant is awake and responsive. We'll talk in just a minute what to do if the infant is not awake and responsive, the steps that we need to take. So our infant is awake and responsive. We want to check their breathing sounds. So what we'll do is we'll slightly tilt the infant's head back. We'll take our ear, we'll place it up close to the infant's mouth, and we're going to listen to breathing, and we're also going to look down the infant's chest and abdominal wall to see rise and fall. And so listen to the breath sounds to make sure that the breath sounds are normal, and normal infant breath sounds should be relatively quiet. So if we're listening to the breath sound and it appears that our infant is in distress, having a difficult time in breathing, then what we'll want to do is we're going to want to go to page 8 of the textbook, and we're going to want to run the normal breathing checklist, which we'll talk about here in a little bit. The next thing that we want to do is we want to check for bleeding anywhere on the infant. Now, when we walked up to the infant, maybe we didn't see blood spurting out of the infant or the infant covered in blood or anything like that. We want to make sure there's not bleeding on the infant somewhere we can't see. So what we'll want to do is we'll want to take our hand, we'll want to hold the infant's head, to hold the infant's head still, and we're going to want to put our hands underneath all around the infant, looking at our hand, making sure that there's not bleeding someplace else. If we do find bleeding underneath the infant, then we'll need to go and run our bleeding control checklist and stop that bleeding. Now let's go back in the flow diagram. Let's say that our infant is not crying and our infant is not responsive. So what we'll want to do is we'll want to tap on the infant's foot, and we want to call the infant's name. If the infant wakes up, begins crying, then we'll just continue to run the infant primary assessment by checking their breathing and moving on. If the infant is not responding to you tapping on their foot and calling their name, then go ahead and open up the airway and listen for breathing. Look at the infant's abdominal and chest wall to see if it rises and falls. If the infant is not breathing, then we need to perform CPR right away. And one thing that I tell all parents, I believe that all parents should go and get hands-on CPR training from the American Red Cross or from the American Heart Association. It's really a great skill to have. Now, we'll teach that in this class, but it's no substitute for real hands-on training that you would receive from those two organizations. So once we have checked the infant's airway, we've checked the infant's breathing, and we've checked for the infant for bleeding, and we've taken care of all those things, then we can go on to the infant secondary assessment.